Catherine, thank you for that introduction. I appreciate that. I hope it's okay if I wander around. That's part of what I do to dispel the nervousness I have of being with you. I am truly honored to be here. I really am, and I'm grateful for the invitation to be here, not necessarily to speak or address, but just to participate in this conference has just been absolutely remarkable. I had no idea what was going on in terms of global surgery. Before I begin, though, I have both a disclosure and a disclaimer. I am told by the Office of Continuing Medical Education that I have to disclose personally that I am the founder and chairman of the board of Megadyne Medical Products. We are one of the sponsors of this conference, and we have a booth out there. But this should not be construed as an invitation to purchase any of our products, or that I hope you won't think that I'm advertising. But with that disclaimer that disclosure out of the way, let me also express a disclaimer. I'm not sure why I'm here. I'm not a global surgeon. I'm not from academia. I'm not an engineer. I don't claim to be a businessman or even an entrepreneur. I'm pretty much just a humble country doctor from Sandy, Utah. And so I apologize that I'm not any of those above things, and I don't come up to the level of Dr. Jeff Peters, who went to medical school with me, and I never thought he would amount to much, and he really has. What I'd like to do today, though, is to tell you a little about my personal experience in taking a medical device from its conception to its successful commercialization. Now, I want you to bear in mind that I did this 25 years ago before the student labor laws and the use of students. I hope you've noticed that virtually everybody who's talked about these medical devices and their attempts at commercialization have involved the use of students. And I think it's absolutely wonderful. My experience was so many years ago, there wasn't this integration between medical school and biomedical engineering. The second part, I would like to talk a little bit about the attempts on the part of Megadyne to disrupt the paradigm of medical devices. Dr. Lee alluded to this in her opening remarks yesterday, and so I will expand just a little bit on that as well. To begin with, though, let me tell you a story. 40 years ago, Russell Myers devised a comic strip called Broomhilda. And for the last 40 years, he has written a comic strip every single day involving this little green witch. The one I'm referring to, she's standing on the edge of a precipitous cliff looking down. Across the cavern is another one of the characters, and this is Gaylord the Buzzard. And Gaylord says to Broomhilda, "Come over here, I need you." And Broomhilda says, "Well, how am I going to get there?" And Gaylord responds, "Jump." And Broomhilda looks at the depth of the cavern and the distance to the other side, and she says, "I can't do that." And Gaylord responds, "You're letting your negative thoughts persuade you not to do something you can do. Now, I'm writing a book on the power of positive thinking. I know you can do it, so do it." Well, Broomhilda looks at the depth of that cavern, and in a moment of positive mental attitude, lifts her leg and takes a huge jump straight down. Now, Gaylord on the other side sees this, and he calmly turns around and walks away and says to himself, "I think I'll include a chapter on developing your leg muscles." And so what I'm going to talk about today is no matter where you are or what you're doing in terms of conceptualizing ideas, there are three things. The first is the identification of a problem. The second is developing an idea for a solution to that problem. And the third is the muscle, or the leg work. And without all three of those, whatever it is you do is not going to come to fruition. So my story begins in 1984. It was a good year, according to George Orwell. 1984, I was a practicing surgeon in South Salt Lake. And I became increasingly frustrated with the buildup of char on the bovie tip. Those of you who've been in the OR have had that experience. And it got to be an obsession with me. And finally, after kind of yelling a few times at the scrub nurse, she said, well, if it bothers you so much, do something about it. And I thought, you know, she's right. I'm going to stop complaining about it or do something about it. And so it wasn't too long after that I came up with an idea that I thought might be helpful. And so the first principle that I want to relay is this, that simplicity is the ultimate sophistication, according to Leonardo da Vinci, used by Steve Jobs in his first brochure for the iMac. And so what's simpler than putting Teflon on the end of a bovie blade? And so I thought that's what I'll do. Now the second principle is this. Ignorance might not be bliss, but at times it can lead you to some discoveries that you otherwise wouldn't have done. So I put Teflon on the blade. Now if it's easy, somebody has already done it, correct? We heard that earlier. What I didn't know is that the energy in the electrosurgical device is a radio frequency energy. In other words, it's a form of an electrical current. And Teflon, as you probably know, is an insulator. Well, I was too stupid to know either of those things, and that's why nobody had ever done that before. So I just applied some Teflon to the blades and tried them on some meat, and they seemed to work just fine. So we designed some clinical studies and sent them to the operating room, and indeed they worked really well. Teflon-coated blade. Well, it got into the hands of some of my colleagues. They really seemed to like it. I thought I really had something here, and so maybe I should begin to commercialize this and sell it. Now, bear in mind that my first goal was not commercialization. It was simply to create a device that I could use that would eliminate my frustration in the operating room. So, but I decided that it might be time to do something about it. And so I formed a company to actually manufacture and sell these blades. Now that brings up the third principle, and that is the identification of a problem and the idea to solve that problem are the easy steps. The muscle and the legwork is the most difficult part of the whole thing. In fact, T.S. Eliot once said, between the idea and the reality falls the shadow. So I had no sooner started this company than I realized I was really, really in deep trouble. There was a lot to do. And you'd think to yourself, well, simply coating a tip with Teflon ought to be pretty easy. But there were a lot of things that we had to overcome. We had to get the thickness exactly right. Not knowing that it was an insulator, I did find out, though, if it was too thick, it didn't work, and if it was too thin, it flaked off. We had to be able to apply it uniformly. Surgeons like to bend the blade, and it would crack and fall off, so we had to find exactly the right application techniques. We had to deal with IP. We had to deal with FDA approval, and then how to sterilize and package, how to store these. And of course, last of all, and most importantly, we had to figure out how to advertise and sell and distribute this new product. I had to do that. Well, I was out of money, spent a lot of money already. I was out of time. My wife said, it's either your project or me. And I said, well, I'll choose the project. And she said, that's not the right answer. And so I learned the next principle, and that is, and by the way, I was really feeling like I had leaned out the window just a little bit too far. The fourth principle is this, that we had to do one of four things. Either had to, this third principle, sell the idea, lease the idea, drop it all together, or I had to collaborate with somebody else. Now remember, again, 25 years ago, there wasn't this form of collaboration that we hear about, that we've heard so much about today. Well, I decided that it was time to find partners, and I learned the fourth principle, and that is the concept of the entrepreneurial team. I was convinced at that time that there were no single entrepreneurs. There are certain skills that are required to see a device from its conception to its successful commercialization. And I don't think any one single individual has all those skills. And we've seen it as the digital age blossomed just a few years ago. We see it today all over the place, and one of these programs is called the Bench to Bedside. And these are teams composed of medical students, bioengineering students, and students from the MBA program. And Bob Chestnut had a nice project today on a light that has come to fruition through Bench to Bedside. This is a competition. They won last year. I think you got $10,000 in a prize, and they're using that to take it to the next step. So, entrepreneurial team. And once I realized that, then things kind of smoothed out, and I started looking for some partners, which is what we did. I found 2 additional partners, and they not only brought some of the expertise that I was really looking for, but they brought some money. And that was very important to me in those days. I had spent all that I possibly could. Now, once we got together and organized, I realized there was one important aspect missing, and that is we didn't have an engineer. And so the very first person we hired was an engineer. And we couldn't have done it without an engineer. Anyway, then we began to actually do all the things that I couldn't do alone: manufacturing, storing, selling, advertising. And at this point, we had not sold a single blade. The first surgeon in Salt Lake to buy one of our blades was Dr. Richard Price, who was the father of Ray Price. And he was here a minute ago, and I said hello to him, and that was the first step in the commercialization of this. Now, 25 years later, we are a full-service electrosurgical company. We produce everything for core electrosurgery, from the actual generators to the return electrodes. This is us in our 25-year anniversary in our little place in Draper, Utah. Okay, now let me talk to you a little bit about changing the paradigm. First of all, a review of electrosurgery in general. There are estimated to be 60 million cases, surgical cases performed worldwide yearly. Most of those, 75 to 80% of those, will depend in some form or another on the application of radiofrequency energy to cutting and coagulating. We've all been there, those of us who are surgeons and in the operating room, and we recognize that that becomes an integral and important part of surgery. Electrosurgery is considered to be the most hazardous piece of equipment in the operating room. And it also contributes as much as almost anything else to the discarded debris from an operating room. In fact, it's estimated that every year in the United States, over 9 million pounds of waste is created just from electrosurgery. This demonstration shows a typical hospital with 5 operating rooms, and in 1 month they will accumulate over 100 pounds of debris. And as has been noted before, this is not recyclable. This is biological hazardous and is incinerated and destroyed. So there is no recourse from this. And so in 1997, Megadyne decided that it was time to redefine our focus, to develop products that would meet the following criteria. The time was absolutely right, because this is when we became interested nationally and worldwide in some of these things. The first is that we felt like we could truly increase patient safety and clinical outcomes. Remember, electrosurgery is still one of the most hazardous events in an operating room. The second thing is that we felt we could reduce costs significantly. And the third thing is that we could increase our ability to protect the environment. And so we've done that, and let me just describe 3 products, again, that Dr. Lee referred to in her opening comments. The first is what we call the MegaSoft. It's a patient return electrode. Most of you are familiar with the sticky electrodes that go on a patient, and they take the radio frequency current from the patient back to the generator to make a complete circuit. Those sticky pads are disposable. They do lead to patient burns periodically at the pad site as current density becomes greater. And so ours is a single large pad embedded in a pressure-reducing gel. Patient lays on that. They put it on the operating table in the morning. Patient lays down on that. They can use it all day long, and it significantly reduces the cost. Besides, there is nothing to be thrown away. It's all reusable, and not only that, it's much safer. In nearly 50 million cases, we have had 0 pad site burns. The next product is a reusable pencil. One of the things we've discovered is surgeons, at least in the United States, push back on certain things. One of the things they are so committed to is the use of a disposable pencil. They like it. They like the feel of it, and they like the consistent reliability of it. But we don't like throwing it away. So we have a reusable pencil that is guaranteed for 12 uses with a lockout mechanism. After 12 uses, then it's thrown away. The third thing is a semi-disposable laparoscopic electrode we call a resposable. And the shaft itself is reusable. It has indicator shaft technology so that if a little tear occurs in the insulation, it's noted and it can be thrown away. But only the very last inch, which is coated in PTFE, is disposable. And it does decrease significantly the amount of disposable waste. And in fact, if you compare what we use in terms of electrosurgery with what has been used in the past, we now are down to 13 pounds as opposed to 110 pounds in terms of protecting the environment. We've had several awards for green products, and this has also allowed us to contribute greatly to charitable organizations and missions, and we are grateful for that. Okay, what does the future hold? Well, there are lots of things that can be done on RF energy. There are lots of areas to explore. Easy things, smoke evacuation, vessel sealing, which is very, very useful, but very, very expensive. A lot of work to be done there to reduce the costs. All kinds of things that can be done in RF. All things in terms of the operating room. And who is the innovator? Well, it's you. It has to be you. There is nobody else in the operating room, in the field, all around the world that sees the needs like you see. And so when you see a problem and a need and an idea comes, it's the time for collaboration with Paul or Bob or one of the others who can help you do the most difficult part of all, and that's the legwork. That's what I learned 25 years ago. Thank you very much.